before we see them, that they had not so good treatment, which can delay healing, increase eventual costs, and produce a worse result. This is a wound of the horse that's been caught in wire, and we know it's not it's several days old. We've got pus here draining from the wound, retraction of the edges of the wound as well, and this clearly hasn't had the best treatment before we've seen it. So hopefully I'm going to impart some useful information to you all tonight. Trying to cover three main areas with the talk. The variety of conditions, what you're going to do with those conditions, and what you shouldn't do. First aid, what's it mean? First, the initial response that that it involves you, not the vet. We're not going to be the first person to see that horse. So you're going to be the first one, or the livery yard owner, or the groom or person looking after the horse. An aid, we're looking to do assistance to help the horse, not damage the horse, but keep it moving, optimise its welfare, pain, and condition. Areas I'm going to cover tonight, got injuries and wounds, which is a large proportion of it, lameness, colic, the sick horse, collapsed or recumbent horse, and foaling mare. If anyone wants me to talk or advice for anything else, feel free to ask any questions at the end or as we go along. Okay, gone out and found this horse in the field. What are we going to? Does anyone have any ideas of what we're going to do with it? Yeah. Yeah, probably. Looking at this wound, this isn't a fresh wound, so it's been dried out, and we can see we've got retraction of the wound edges here, and a lot of exposure. It's a dirty field, so there's likely to be contamination of the surface.
So how old do you think that wound is then?
Probably at least 24 hours. That level of dryness. We can't see much. There would have been hemorrhage at the time, but we can't see much hemorrhage now. So, yes, we're going to have to remove it from this dirty environment. We probably need to stabilise that wound first. Try and clean it, bandage it to stop any further retraction of the wound edges. Where it is, there's likely there'll be a tendon underneath that, if it's moving around, can cause further distraction of the tissues. So we're going to aim to clean it, bandage it and support it, and move it safely. This is the same wound a bit further down. We've dressed it up and we've now brought it into the clinic. So the first thing we've done, you see we've got rid of most of that dry contamination of the surface. So we would generally we would use saline to flush the surface and gently remove all those dry edges. You see, actually the wound actually looks a lot healthier already, and this is just an hour or two later. Clean back to the bone surface, and we've also cut away anything that we think is non-viable, so tissue that no longer has a blood supply. And we're trying to limit movement, so they've got a nice Robert Jones bandage on it, and that provides pain relief. We're pushing the wound edges together, trying to get them to minimise scarring and support and restricting the movement of that leg at the same time. I thought this was quite a good one. So, sort of things we'll do with the wound. Typically, we wash them with a saline solution. It's very handy for us. We have bags of fluid ready made up for us, but it's also very easy for you guys. A teaspoon of salt and a pint of water is effectively saline. And we will syringe it onto the wound to produce some pressure there. We'll put a needle in the bag, and that produces between 8 and 12 pounds per square inch of pressure. And that's enough to drive bacteria and dirt and contamination off the surface of the wound without damaging the tissues further. Very easy alternative is the little hand spray bottles that you use for watering plants, and those will produce a similar sort of pressure for cleaning wounds, and available for £1 or £2 from a garden centre. Keeping wounds moist is very important for healing. If If you cut yourself, you'll form a scab on the surface of the wound. And yes, the surface of the scab will dry, but underneath it's keeping the wound edges moist, allowing them to heal together. If we allow things to dry out, the wound edges will dry back. These delicate tissues, the new epithelium forming over the wound, will be damaged. So very much moist wound healing, so keeping wounds covered will speed healing and minimise scarring. We use hydrogels. There's various different ones on the market. These will help keep the surface of the wound moist. They'll also remove any bacteria and gross contamination from the wound. Non-adhesive dressings. We want to be able to cover the wound and keep it moist underneath, but we don't want something that's going to stick to the wound, so when we pull it off, it pulls off those new cells forming to repair itself. So a non-adhesive dressing. If you ever any of you've opened a melon dressing, it's got a nice shiny side to it, and that's the side you should always apply to the wound. And keeping nice clean bandages, soft band, Gamgee, cotton wool, knit foam, all the sort of things, good support for the limb and helping to minimise scarring. What shouldn't we do? Purple spray. It's I think one of our pet hates. It's so disheartening if we go to a wound or an injury case that possibly we could have sutured back together and it's got purple spray poured all over it. The purple spray is a particulate spray. It's little fine particles, and when you spray them on the wound, the body recognises it as a foreign material and it will make a reaction against it. So it will start to suppurate, produce white blood cells will try and remove this contamination from the surface. Once that's on there, we've got no chance of suturing it, and it's very difficult to clean it off. So please don't put purple spray on things. Traditionally, a lot of people use a lot of wound powder. Again, this will produce a foreign body reaction if you put it on the surface of the wound. So we tend not to use wound powder at all. Although it does have some antibacterial properties, the wound will react to its presence. This is one of my personal pet hates, animal linsex. It's wonderful for feet. Although it says I know it says on the packet wound dressing, it does produce a lot of, I think it's like putting a bacterial culture plate on a wound. There's a lot of nutrients there to breed bacteria. I think the wounds are far better with a hydrogel on, which will draw off any bacteria and contamination and keep the wound moist than animal linsex poultices.
Are you saying never use purple spray?
No, wouldn't use it on a horse at all. Traditionally, where it came from was the old antibiotic sprays and it was a combination of oxytetracycline, which is a widely used antibiotic, and gentian violet. And so everyone associated putting purple spray on wounds, but it still produced a foreign body reaction even with the antibiotic on. Most of the sprays you'll buy like that in the tack shop, they don't have antibiotics because in them you have to purchase, if it's got an antibiotic in, you have to purchase it from a vet or a pharmacy or somewhere. So they now produce just a purple spray, and most of them don't even have gentian violet in because that was carcinogenic. So so we generally would advise not to put purple spray on wounds.
But would you hippie scrub them?
Yeah, an alternative. Ideally, spraying them with saline is great for washing them off. If they're heavily contaminated with a lot of pus, a dilute solution of hippie scrub, either 20 or 40 to 1 diluted with water, will help. Is good to clean a wound with. The nice thing about washing them with saline is that pressure, putting the pressure on the wound, driving bacteria and dirt off the surface without damaging the underlying tissues. So if you've got if you've got a very grossly contaminated wound, the first thing you do is you could give it a gentle wash with very dilute hippie scrub. If you use a hippie scrub more concentrated, it can damage the cells underneath the wound. Okay, and there's a wound that's been sprayed nicely with purple spray all over. So a lot of not that wound. Obviously, it's lost a large amount of tissue, but wounds. There are a lot of wounds we see that we could have sutured that have been sprayed with purple spray, and they generally won't do very well at all, or you spend hours cleaning them up. Important thing with wounds as well is to recognise where they are. Location is so important. Although this may not look too major a wound on the outside of the hock, it's over the joint and it's into the joint itself. horse that gets infection or opens a joint, or if a horse opens a joint, it will get infection in there, and that can have serious life-threatening changes. It may well become, permanent lameness. So it's important to recognise these and get them. This would need a flush out on the table, flush all the contamination out. And the sooner we get onto them, the better the prognosis is. Penetrating wounds to the foot. The X-ray here of a horse that's trodden on a nail has gone through the foot. And it's very important to know where in the foot the penetration has gone through. This would be quite a serious one here. It's in the region of the deep digital flexor as it goes around the back of the foot. Quite close to the navicular bursa, so again you can treat the navicular bursa like it under a traditional joint, so it gets infection in there that can have catastrophic effects for the horse. If the nail was nearer the toe, there are no joint structures there, and if it hadn't chipped or the pedal bone, that wouldn't be quite so serious. But knowing where a penetrating wound of the foot is vitally important. Wounds involving tendons, again, that's serious. So here we have a wound in a hind leg of a horse, and it's lacerated through into the superficial digital flexor tendon running down the back of the leg. It's also in the region of the tendon sheath, and you can see this yellowish fluid is leaked down here, and this could well be tendon sheath fluid. Again, this will need flushing surgically. So a very, very dangerous wound for the horse. Penetrating wounds in the body cavity. Apart from the severity of where it's gone, this one may well have penetrated the peritoneal cavity and lead to an infection there. So it needs fully assessing as to how deep the penetrating injury. If you find a horse standing with something sticking out of it, it's probably best not to pull it out. It may well have gone through a major blood vessel, and we've got a better chance of, just keep the horse still. Don't move it around. We've got a better chance of seeing where it's gone through. You pull it out and it's sealed off the tear of the blood vessel, you may have a huge amount of blood on the floor very quickly. These things are rare. We don't see many horses that run on stakes. Okay, eye wounds. That's quite a serious eye wound there. These can be treated really effectively if they get gone onto immediately. Even small nicks in the edges of an eyelid can have long-term life-changing effects for the horse. Both eyelids need to form a nice seal onto the eye itself, otherwise they can cause some irritation and ulceration onto the surface of the eye. But most of them can be surgically repaired, either under local anaesthetic or under GA very effectively. This horse was fully repaired with very little scarring at all. Hemorrhage. We get lots of calls. My horse was bleeding. It's got an arterial bleed, and everyone's in a panic about it. In 20 years, I've only ever seen one horse bleed to death, and that had gone through a major artery at the top of its leg. If you see a little squirt coming out of the bottom of the foot, it's not going to bleed to death. Please don't worry about it. How much blood do you think is on the floor there? Has anyone guessed on sort of volume?
2 pints.
Pint. Yeah, probably no more than a pint on the floor there. So in terms of a 500 kilo horse, that's quite a small amount. Just a bit of an illustration about how much blood a horse has in it. Blood volume, we can estimate at approximately 10% of the horse's body weight. So if we say a 15-2 average cob is about 500 kilos, then its total blood volume is 50 litres. It's about 120 pints, I think. And a horse can lose over 40% of its blood volume before it starts to get a bit wobbly.
It's more than a human then, isn't it?
Yeah. So I mean, that's a substantial amount. You can see the previous slide, it's much smaller. Practice I worked in previously, the horse had breathed in a bramble, and it was sitting down in its airway, and someone tried to remove it by pulling it back up. Well, unfortunately, the thorns were sticking backwards, and that started to bleed, and it bled successfully three gallon buckets. One was still standing after full three gallon buckets. Yeah. Okay. Just going back to the hemorrhage thing. When I was in Pony Club, it was always taught, if you do get a serious bleed, just put pressure on it. And the thing in the Pony Club was take your Pony Club tie off and tie it with your handkerchief tightly over the wound. And that will, if it doesn't stop the bleeding, it will certainly slow it down. Very wary about telling people to try and put tourniquets on, because if they're left on for too long, they can do damage to the tissues down below. They won't have any perfusion, blood flow there. So just pressure directly over the point of bleeding. And yes, use a tie, something simple. You're bound to have something to hand. You can just jam over the wound and tie it on tight. Okay. Gone out to the field, and in fact, there's you found your horse and he's on 3 legs. What are you going to do? Yeah. It's difficult. I think the first question is move or not to move. I think you need to look carefully down yourself. Have a quick look down the limb and see if you can see any large obvious wounds. If it's at a funny angle, there might be a break. In which case it's probably don't move the horse if it's not non-weight bearing. Typical thing, other things we see is laminitis, and you don't want to force walk a laminitic because that can quickly increase the rotation of the pedal bones. So laminitic standing there at the field, if it really doesn't want to move, leave it exactly where it is. We can come out, support the feet before we try and move it, or get some transport for it. Non-weight bearing lameness, joint infections. This horse has had a wound through into a joint, and you can see there's fluid being flushed into it, and it's jetting out of the wound because it's communicating with the joint. These guys are going to need surgery, but yes, stabilisation of the wound of the leg before they're moved again. Foot abscesses, well, they're the common one, and 95% of things, probably the non-weight bearing horses we see, have probably got a foot abscess. They need cutting out, but probably they're safe to move. But if you're uncertain in any way, don't move the horse. If you think there's any risk of that horse having a fracture, then keep it right where it is and call for assistance. That's a horse that's had a fractured leg, and we have a Robert Jones bandage on. And this bandage is ideally designed to stop the horse moving its leg and provide instant support. And if it was to move away, then you could get distraction of the fracture. This was a hopeless fracture anyway, but you can see here the horse has shattered its pastern with multiple pieces of the fragment. Also, the fracture extends into the can bone itself as well. This was hopeless. There was no way this was going to get repaired. But the horse may well have it may well be safe for a lot of fractures, and if you can get them stabilised before you move them, then holds the fracture in place and gives it a lot better chance of repair. If you move a horse with a fracture, it can shatter and distract, and that can be the end of things. Colic. So one of our common emergencies, and someone asks, what do you get called out for at night? But it's either wounds or colic usually. The first thing to do with a colic is call the vet. Straight away. Why is that? A lot of colics will present with a variety of signs. So it may be very mild pain to start with, or maybe quite severe pain. Some of them cases will be surgical, but you cannot tell on pain alone. Some of the surgical cases start off with very mild pain. So it's always best to call the vet straight away. If it's surgical, the sooner we get them onto the table, the better chance of survival they have. So the colic, always say to the clients, first thing, call us. What are you going to do to the horse? Are you going to walk it or lunge it? Walking is good to encourage normal gut movement and help with pain. The other thing it'll stop them self-traumatising themselves. So we've all seen plenty of colics that colicked overnight, and we've all been in bed and asleep and found them in the morning and they're bashed around the face. But it's good to try and stop them doing that damage themselves. They're feeling rotten enough as it is without bashing themselves around further. I think the old thing was used to be to say that, oh, don't let the horse roll because it might twist its gut. If the horse is rolling, then it's got really, then that obstruction or whatever the cause of the colic is has happened already. The rolling isn't going to make it worse, apart from it may traumatise the horse. So yes, it is a good idea to walk the horse in hand, just helps with pain, stops them damaging themselves, but it's not going to, whatever's happened has already happened. Lunging can help with certain colics, things like impactions, mild spasmodic colics, so certainly can help with some of them. If it's very severe, where the gut's obstructed through a twist or something like it's looped around it, or it's, then it may not be quite such a good idea to lunge them. So certainly walk a horse. Lunging may help in some cases. What else to do? We'll go on to that in a minute. Rugging a horse up with colic. I don't like putting too many rugs on a horse, especially when they're sweating. The sweat may be a reaction to pain. It may be because the temperature is raised. So I think keep rugs to do rug them, but don't over rug them. And also, if the horse is getting up and down, if it's got too many rugs on, they may interfere with it jumping up and down as well. Don't feed a colic. A lot of them can be impactions, and it's frequent. We'll go, oh, we can try and encourage it to eat some hay. Probably, just wait. Yes, give them access to water. They may be a bit dehydrated, so if they want to drink, that's fine. But don't feed them. Chewing and adding extra food. If they've got an impaction in there, it'll just increase the impaction and delay, or certainly make it much harder to clear it. So free access to water, don't feed. Let's possibly lunge them if they're not too painful. Certainly walk them. Don't over rug them. And often, if you're going to call a straightaway, don't try and medicate them. I know lots of people have the old sachet of bute around here. It can change the picture of how we look at them when we examine them. So I prefer it certainly if they haven't had bute before I see them, but we'll always see a colic straight away. The sick cause. So typically the horse with a nasal discharge, it's off its food, high temperature. I think you need to be aware of the potential for cross-infection to other horses. That's the first thing. Most of you have got your horses on yards with multiple other horses. So try and isolate it as much as possible. Try and keep them stable away from others, or if they're out in the field not within too much contact with others. With respiratory diseases, we usually say give them about 100 metres spread. Now I know that is very difficult in most situations that most people are in, but certainly try and isolate them in a stable. Avoid cross-contamination with other horses. Don't with food buckets, grooming utensils. Try and avoid sharing tack and things like that. And gloves, overalls, and a set of boots outside the stable can well help. So typically infectious things we see, respiratory diseases, a horse with diarrhoea, certainly try to isolate that as much as possible. A mare that aborts, this is a slightly different situation. If you've got a mare that's aborted, you're probably better, if she's in a field, leaving her in the field and removing the other horses. The aborted material is highly infectious, so we want to keep it all in one place rather than moving the mare around, who's likely to contaminate various areas if we do that. I think one of the big highlight of things at the moment is equine herpes virus with the neurological form of that. There's been quite a few. It's been in the horse and hound. I think lots of people are on discussion forums. So it's been Gloucestershire, throughout the Cotswolds, West Country. There've been numerous cases of the neurological disease, and quarantining your horse is critical for trying to prevent the spread. Sorry. So keeping the horse isolated, try and prevent cross-contamination with hands and areas like that. The recumbent horse, this is always an emotive time. A lot of these horses we get called out to that are stuck down in the field are older horses. I think you need to assess why is the horse down on the floor. Has it been struggling for a while with a lameness? Is it stiff? Has it been hard to get up and down for a while? What sort of condition is it in? Has it been losing weight? Has it been losing muscle? And some of these very old ones out in the field, is it right for us to try and get them up? And I think there's a question you should, if you've got an older horse, you should ask yourself before this happens as to what your decision is going to be. Once they're down, horses don't do very well down on the floor because of their size and their bulk. They get damage of pressure sores, damage to the muscles because of the pressure on the muscles. Rub the head around, so damage the eyelids, scratch the eyes. So you can see on this horse up here, he's taken all the hair off above his eye, bruising around there. There's a sore on his stifle on that upper leg. So if you find your horse down in the field, certainly protect. First thing, get a towel under it, protect the eye so it's not going to rub in the ground or the bedding. Try and ensure it's warm enough. It's catch-22. Do you want to put lots of rugs on the horse, which might make, certainly if it's an old horse, it's quite weak, that's going to make it harder for it to get up. So possibly just a light cover over the top, but try and keep it out of the wind and the wet. So bales or shavings around it produce a windbreak. They're often better if you can sit them up in sternal recumbency. So that's like sitting up on the chest. That removes a lot of the pressure and weight from the shoulders and on the legs. So they've not got a dead leg or so much pressure damage. So possibly if you sit them up on the sternum and get a couple of bales of shavings or bales of straw or something up under the shoulder to keep them propped up like that, may well help them. When we come out, we like to try and do an assessment of them, try and discover why they're down. Is it just an old age injury? Is there another cause, a cardiac cause, neurological cause? Have they nerve damage from somewhere? And again, we've just been mentioning about equine herpes virus, neurological form, which is very topical at the moment, and that's a possibility. Some of those horses will recover and get up. Things like tetanus, we don't see so much tetanus in this area, but certainly in parts of the country it is quite common. So again, we'd always recommend that every single horse at a very minimum is vaccinated against tetanus. So usually I found if they're down with tetanus and it's a full-size horse, you've got very little chance of saving them. So yeah, try and assess what is wrong. We've got a very good fire brigade in Berkshire with an animal rescue unit, so it may well be appropriate to try and assist the horse in lifting it. This is some of the equipment they use and similar things that we can use in practice. Head guards for a horse down. Obviously this one's not like just modelling the head guard. But yeah, these are quite useful to see. Protecting the eyes and around the face where the head's rubbing on the floor. Again, this is a horse being winched out by the fire brigade. Traditionally, a lot of people are trying to use front loaders. That can be a bit of a problem with inappropriate strapping that can pull and do damage to the horse as you're trying to pull it out. So if you can, certainly in this sort of area, if you want to have the horse lifted, if that's an option, then certainly the fire brigade are very good to get involved locally. But if it is an older horse, if it is an older horse, is it appropriate to get it to its feet? And I think that's something you all need to think about. Yes, we may be able to get it up today, but it might be in the same state tomorrow. We can obviously help them with painkillers, anti-inflammatory drugs, and that may well provide great assistance. But something very, if they're losing a lot of weight as well, that can, it's a slippery slope, unfortunately. Although this doesn't affect many people, I'm just going to talk briefly about the foaling mare, because these are really critical situations for everyone. Foaling a mare happens very quickly. From the start of signs of them pushing to the foal being out on the ground should take 20 minutes. If it takes longer, there's a large risk of the placenta detaching, and the foal derives, while it's inside the mare, derives all its oxygen supply through that placenta. So we have a very small window. When you get a mare that's foaling, you need to identify the legs and the header coming out normally, so that we've got 2 feet. So you can tell their front feet by the way they bend. So you'd be looking for the knee of the horse and not the hock. So you're looking for a forward bending rather than the point of the hock. And the head should be there as well. You should have the 2 legs together, not one leg and the head. Some mares, if just the feet and the head are out, occasionally just a bit of assistance and a little pull is required. You shouldn't be putting great force into foaling mares. They're not like cattle. I don't know if someone's seen cows being calved, but the huge amount of force we put on them, they're a lot more resistant to trauma than horses are. A gentle assistance may be required. If you're at all concerned that things aren't going properly or straightforwardly, call us immediately. Let's say you have that 20-minute time window. It is very, very short and critical. One of the things that happens occasionally, thankfully not commonly, is what we call a red bag delivery. This happens when the placenta has become detached inside the mare. So, so this is completely detached from the lining of the uterus. Why it's a critical situation is that because it's detached, the foal now has no way of achieving oxygen, and it's still got its head inside that bag full of amniotic fluid. So you need to cut the bag quick. If that appears through the foal's vulva, that needs to be opened up immediately so the foal can breathe. Otherwise, it'll suffocate very quickly. Above all, don't panic.
Say that. You said.
There's rarely conditions that are going to be absolutely life-threatening that minute. We're always on the other end of the phone, 24 hours a day, 365 days a year, even just to give you that initial advice. Most of the situations aren't as serious. I think the big panic one we get is if they've got an arterial bleed, and if anyone can see a small jet of blood shooting out, we get a huge amount of panic with that. Generally they're not going to bleed to death. It has to be a fairly major artery for the horse to bleed to death within minutes. Any questions?
What about nosebleed?
Sorry?
What about nosebleed?
There are different causes of nosebleeds in the horse. General rule, if it's coming down both nostrils, it's coming from the lung, and it's usually an exercise-induced problem. They will generally stop on their own with the horse at rest. If it's coming out of one nostril, that can be a bit more serious, because that generally means it comes from somewhere in the head. It can bleed we can get spontaneous bleeding from nasal mucosa, from the lining of the nose. That will be relatively small volume. We can get bleeding from the sinuses, which are the air spaces in the skull, and again those will be small volume. The one very serious condition is that what we call guttural pouch mycosis. That horses have 2 large air spaces at the back of the skull, and across the back of these air spaces are various large blood vessels, arteries, veins, nerves in there, and they can have fungal growths, especially with dusty hay, that grow on the back of these guttural pouches, and the fungus can eat away at the wall of the arteries. Sometimes you'll get a small bleed, which may be a warning sign that you've got one in there, in which case if you've got a one-sided nosebleed, it's generally best to have an endoscope put up there to look exactly where it is. Sometimes you don't, you'll come down and find a vast amount of blood around your stable where the horse has bled from the nostril. Sometimes the blood pressure will drop low enough and you'll just have a very wobbly, shaky horse with a stable full of blood. Others, it can kill them instantly, very instantly. It is a treatable condition, so if we know the fungus is there, there are various options we can do to treat it. So nosebleeds, on the whole, generally aren't that serious, but if you have a guttural pouch mycosis, those are very serious. Choke. Yeah, choke, sorry, I haven't covered that one. Choke in the horse is an obstruction in the esophagus. That's between the mouth and the entrance to the stomach. Generally, when it first happens to the horse will panic because it really doesn't know what's happening. There can be a lot of froth and discharge coming from the nose, horse will attempted retching or coughing. Usually after 20 minutes or so, they'll settle down because they're just used to the feeling. A large number of them will clear themselves spontaneously. So 15 or 20 minutes, they have a good cough and it'll be gone, but a number of others won't. Although it looks very dramatic, it's not an immediate life-threatening emergency. So I think the worst horse I've ever seen have been choked for 5 days. If they're left, they will become dehydrated because they can't swallow any fluid, and they'll be losing fluid constantly because you'll have saliva overflowing down the nostrils. There is also a risk of them developing aspirational pneumonia, where some of the food material will be coughed back up and go down into the lungs. So yes, they do need treating. They're not generally life-threatening, and they are very treatable. But it's a common problem people bring up. And most people, a lot of people recognise that their horse is choked. Usually it happens when they'll put the feed in, the horse will dive into the feed and start to choke immediately. We see choke with various different feed. Usually it's the mashy type feeds will choke, or very dry nuts. Grass nuts partially, so I had a whole run of grass nuts causing choke in some horses. It's always worth getting the teeth checked. If they've not chewed the food adequately, that can be a reason why they've choked as well. Commonest place for them, the obstruction can happen is what we call the thoracic inlet, so at the base of the neck, and that's one of the narrowest points there, so they'll often choke at that level. And you can sometimes feel distension of the esophagus on the left side of the neck with the fluid and food material. But don't panic too much if they do choke. Often they'll clear spontaneously within 15 minutes. If not, then they're very treatable conditions. So. Any more? Anything?
Eye infections?
Just what I was wanting to ask, because I made a mistake with that wound that time. If you've got a wound and it's just, you don't need the vet, it's just, you don't think you need the vet, it's just like a superficial kick, or you think they're going to be alright. I know you clean it up with saline and that, and then do you just don't put anything on it, just leave it to breathe?
Most wounds you're better keeping covered. A, to stop contamination, and then B, keep the wound moist. One point you said about having a kick, if a horse gets kicked directly over a bone, it's probably wise to have it x-rayed if it's lame afterwards. You can have non-displaced fractures where they have quite a minor lameness, so if they've had a kick or a blow directly over a bone, but there's not much muscle covering it, then it's probably worth, if it's lame afterwards, well worth having it x-rayed as a precaution. Make sure there isn't a non-displaced fracture there. Yeah? Right, this is there are 101 different treatments in there. You'll go into a tack shop and go for mud fever. Mud fever is a mixed bacterial and fungal infection of the skin, generally caused by moist, wet conditions. I think initially with most of the mud fevers, you need to get rid of the scab. So you're trying to keep the area dry. So the scab is actually trapping moisture against it. Well, the easiest way of getting rid of the scabs of actually bandaging up with hydrogel. The like vet Lintex gel we use, there are several on the market. So if you bandage them overnight with those sorts of gel over the scabby areas, it makes these scabs very easy to remove. You'll often come to them the next day and just be able to virtually wipe them straight off. So that's removing the area where it's trapping moisture against it. Commonly we tend to use flamazine cream, which is a silver sulfadiazine cream. It's not an antibiotic, but it has antibacterial and antifungal properties. I think a lot of people trying to go for antibiotics for treating mud fevers, and they will actually only treat one part of the condition because it is a mixed bacterial and fungal condition. There's a number of different bacteria and a number of different fungi, whereas the silver sulfadiazine cream works very well. It's best if you bandage it on, although you can apply it directly to the wound. It's much better if you can bandage it on. And I know it's a bit of a faff because you generally have to keep the horse in, but that works very well generally. You know, often in 3 or 4 days we can have the lesion cleared up with the bandaging.
Mark, going back to the wound, do you know, like, if you brought a horse in and the initial reaction on is to hose it down, would you say then don't use the hose at all?
If it's heavily contaminated, probably hosing is a very good idea.
Right.
You know, if there's heavy contamination, you're going to improve the situation if you just hose it. The horse's body isn't going to react to the water on there, so hosing it down isn't a terrible idea at all. Obviously, putting some pressure on there to drive the bacteria and contamination off. If you use too much pressure with water, you will damage the tissues underneath, and you can over-hydrate the wound where they'll swell with the water. So that's one thing. But if it's heavily contaminated, covered in mud, sticking the hose on it is probably about the best thing you can do. Especially at this time of year, where everyone's wading through mud out of the fields. It's very difficult.
Mark, for basic first aid kit then, what would you say you should have in it? We do a basic first aid kit. I don't know, Lucy. Generally, something to wash the wound with, clean the wound with. So either some saline or a sprayer with some salt, so you can make up some saline solution. Hydrogel, you can stick it on any wound really. It's only going to benefit them. So we usually put some hydrogel in. Dressing pads of various sizes. Melanin are cheap. They're very easy. They can go on virtually any wound again. Even as an initial first aid. And you can get various different sizes. Standard 10 by 10. We do a 10 by 20. You can get 10 by 20 as well. Looking then to fix the melanin in place, there's something like a soft band, which is a woven cotton bandage. Again, and that puts a base layer on. One thing to say, you should never put vet wrap directly onto a leg. It's an elasticated bandage and it will pull tight and cause bandage sores. So try not, you should always put something underneath the vet wrap. So there, and then for a minor wound, probably a layer of vet wrap over the top. If it's more serious, then you can put if you wanted more immobilisation, then layers of gamete or cotton wool held in place with a knit firm, which is a cotton web bandage, and then vet wrap over the top of all that. So those are typical sorts of things we'd have in a basic wound kit. It's useful to have a thermometer, so you can keep an eye on your horse's temperature. First sign that a horse is got ill with something is usually its temperature rises. So a lot of racing stables actually take their horses' temperatures twice a day, just looking all the time for a risk of infection going on. So especially large stables, that can be a good idea. Not sure what else have we got in our kit. Yeah. A gamete. Poultices are great for feet. If you've got a foot abscess, even if it's not draining, will soften the foot. Chris, there's a number of feet you go to, and you're trying to dig out an abscess, and it's like cutting into granite, isn't it? If nothing else, even if it won't draw the pus out, it'll soften the foot up, so it makes it easier to pull out. So gamete, poultices are great for feet. Just don't like them on wounds.
You use a disposable.
lots of people put different ways of putting poultices on feet, and nappy is a very common one of putting under the animal lintex and give it some extra padding under there. Duct tape, roll of duct tape is useful for anything. Going over the top of bandages, holding a poultice on a foot, cheap and easy to use, helps to waterproof things a bit with feet as well.
With minor grazers, just kind of tiny cuts, abrasions, infections, just the hydrogel?
Yeah,
That's it.
just hydrogel, yeah.
Obviously, if it's a place where you can bandage fine, if it isn't a place you can bandage, just hydrogel.
Yeah.
A couple of times a day, or how
It's very difficult because the hydrogel will drop out, so it doesn't stick to the skin very well. It does drop out, so we really have to look at bandaging on. So probably just cleaning it. If it's superficial, then cleaning it twice a day.
I spent some time in Spain, and there we had quite a lot of success with an iodine-based solution, purely because of the flies and things.
Yeah.
I don't know how to do that here.
I think Bethlehem cream. The trouble with some of the iodine-based things is they can be a tissue irritant, so they can damage sensitive tissues, and you have, certainly when we're using iodine solution, it has to be very dilute, so as not to cause irritation. So sort of the old Pevidine scrub would a 1 in 40 dilution, because it can damage the tissues underneath there.
That's a question about blood fever.
Yeah.
I mean, particularly in this weather at the moment. Is it better to have their feet clipped out, to hose their feet when they come in covered in mud, let it dry and brush it off, put other cream on before they go out in the field? I mean, what would you say would be the gold standard treatment of preventing blood fever?
Oh.
Apart from not putting that.
Well, I think if you've got the perfect answer to that, you'd be worth a fortune. I generally don't like putting grease or creams on as a preventative. Unless the leg is completely dry and sterile underneath, you will trap moisture and bacteria or fungi against it. So generally don't like doing that. Personally, standard, not too heavy a haired horse, I would wash them off when they come back in and dry them thoroughly. Not use detergents that will remove sebum from the skin surface, which will have a protective effect. But
a slight dilution of Phoebe scrub?
I think you're going to be again moving the protective effects of the sebum or that's on the skin surface. To clip or not to clip? I presume we're talking about the hairier cobby horse